Imagine this scenario. You're at your lowest point, burnt out, raising your daughter, and wrestling with thoughts you can hardly bring yourself to acknowledge. Seeking help, you visit your doctor, who prescribes an antidepressant. This small pill provides some promising relief. And for a time, it does exactly that. In fact, it works almost too well. You start feeling better than ever. A drastic change. But it is short-lived, because soon you find yourself making impulsive decisions, uprooting your life, and moving your family to a remote and frigid town near the Alaskan border. Now here's where things take a turn for the worse. Over the years, a blur of erratic choices leads to a diagnosis of bipolar disorder, and more medications follow. Powerful mood stabilizers. And these meds bring their own set of side effects, taking over every aspect of your life. And then one day, you begin to question, could the very medication intended to help me be causing me harm? What follows next is nothing short of remarkable. Stay tuned to find out how TaperClinic's very own coach, Neseret, escaped a decade of powerful psychiatric medication drugging and misdiagnosis to reclaim her life in a way that defied all expectations.
Neseret, it's so good to have you here to do this podcast. And we're going to be talking today about ketogenic diets and mental health and how they can have a remarkable impact in improving mental health. And I know you have a story to share, and I can't wait to hear it. So I think a really good place to start would be if you could just tell me, what was your life like? What was your mental health like before you discovered the ketogenic diet?
Absolutely. So I pretty much had sort of like the standard Canadian diet for the most part. And I thought I was like eating well. I was on psychiatric medications for 13 years. Mm-hmm. And had very low energy. I slept like 12, 13 hours on it. It was multiple, an antidepressant and lithium.
How old were you when you started on medications?
I was 30 when I was first diagnosed with depression.
Okay.
And then I was put on an antidepressant called amitriptyline.
Yep.
And within a couple of weeks, I became hypomanic. And at the time, I actually had an undiagnosed and untreated hypothyroid disorder as well, which mimics psychiatric symptoms.
Okay.
So, and then the result of that, I was trialed on multiple psych drugs, which I had adverse reactions to pretty much all of them. Mm-hmm. And I felt like I needed to stay on the medication, which eventually what I found that worked was mirtazapine, a medication called mirtazapine.
Yeah.
And when I say it worked, I mean, I slept like 12, 13 hours. I was sedated. I didn't have energy. I was still experiencing highs and lows. And I gained weight actually on mirtazapine. I probably gained I'm a small person. So I just gained about 20 pounds. Like I could hear my knees and ankles talk to me, right? Yeah. I think when I was like fully pregnant, I was 130 pounds. So 20 pounds may not seem like a lot for a lot of people, but it was a lot from my frame of body. Mm-hmm. So that was kind of what was going on. And I was able to still function in my work, but I just felt the effect of just, the sedation, the tiredness, sleeping 12, 13 hours a day, having there was some cognitive issues as well. And all of that was, it was a lot.
Yep.
And I felt like I couldn't just get off of the drugs either.
And when you were started on medication, when you were in your early 30s, what was like the rationale that was given for it? Some people get told they have a chemical imbalance. Some people said, hey, this will just help you feel better. What was that discussion like with the doctor who put you on the meds?
Sure. Yeah. So hindsight is 20/20. So when I look back now, at the time when I was diagnosed with and it was a family physician, like a walk-in person that diagnosed me with depression. So I had just come off of working 4 years in acute care, like full-time, and I was in burnout. Mm-hmm. I had the untreated, undiagnosed hypothyroid symptom. And I also had like significant childhood trauma that wasn't addressed ever, really, when I look back now, as in living in a war-torn country, moving to a refugee camp, I lived through like physical abuse until I left home when I was 16. There was just a whole bunch of things there that was never really touched. Then I go to university.
Because that's your story, right? What country did you grow up in?
Ethiopia, East Africa.
Yeah. And then you emigrated to Canada.
Yes.
Right. Okay.
So we were in our refugee camp for 2 years, and we found sponsors to come to Canada.
Okay.
And so that was when I was 13 years old, about 1993. So I grew up here and went to university, graduated with honors, a full scholarship, went into psych nursing. That's the only thing I ever practiced.
Yeah.
And then when I was 30, I think I went after working in acute care, seeing people at the height of their illness, people who are having a manic episode, really severely depressed, eating disorder, OCD. Like we saw, it was a catch-all unit that I worked at. And so it was tough. Like I know, the clientele we work with now, people with protracted withdrawal and things like that, that's really hard to see people deeply suffering. And it was the same thing with acute care. And I think by the end of it, like working full time for 4 years, it was pretty tough.
Okay.
So I think at the time when I was diagnosed, there was no really a holistic discussion around these topics. It was more like I had zero energy, like what with low thyroid, and then the burnout and all of that wasn't really touched on. The same as trauma, which in the system is kind of swept under the rug most of the time. I think half of the people that come into psychiatry are misdiagnosed when they're actually what they're experiencing and going through is grief and trauma response.
Mm-hmm.
So I think that was the case for me. And the typical protocol would have been to rule out, to make sure to treat the hypothyroid before you put someone on an antidepressant. But I was started on Synthroid and amitriptyline pretty much on the same day.
Wow. You said that you became manic. I mean, was this to the point where you went to the hospital? Or?
It was hypomania. So I've never really had like a manic episode.
Okay.
Which is interesting because I know it's milder.
Yeah.
And you can really fly under the radar when you're like hypomanic.
Yeah.
It's very seductive.
Yeah. Because it feels good.
It feels great.
Yeah.
You feel like you're on top of the world.
You're so productive. You have so much energy.
I actually thought at that point, even though I had been a psych nurse for 4 years, I must have been deprived all my life. Like I did not know it was possible to feel this way.
Yeah.
But, Peter Breggin talks about medication spellbinding.
Yeah.
That's how it was. Like I was like, there's like a voice in the back of my mind thinking, is there something going on right now that's a little bit off? But then I had never felt this good in my life. So this must be like, I must be missing something. Yeah. I didn't know it was possible, but that is on a drug.
Yeah.
Right?
Yeah.
Literally.
Yeah.
Yeah.
And one of the things about hypomania is, people do things that they regret. I mean, were there any consequences of being in this altered state from the medication?
Huge consequences. Okay, where do we start? First of all, I quit my job at that time and decided to move across the country with my daughter when she was like 7, 8. My partner at the time, not my current partner, my previous partner was in Halifax. So we separated. I basically moved.
Yeah.
I spent half of my pension. And the other piece was another thing that came with mirtazapine was I was hypersexual.
Yeah.
And I had never experienced that before. Like I was a monogamous, heterosexual person.
Yeah.
Just an introvert.
Yeah.
And I became very social. I was dating multiple people. I wanted to explore something called polyamory.
Yeah.
With my daughter, I felt like I was so busy with everything that I wasn't present.
Mm-hmm.
And then in the winter months, fall and winter, I would go into a huge depression, like suicidal depression. So in terms of the cost, Daniel Amen, he's the guy who wrote Change Your Brain. Mm-hmm. He talks about that putting someone on the wrong medication or giving them the wrong diagnosis can have a tremendous impact socially, financially. That relationship the previous relationship I was in, it was 9 years, ended.
Yeah.
It was by the time I was 36 years old, my life was like in disarray. And I had this intensifying suicidal ideation throughout the time that I was on psych meds. That was another sort of effect that I had to deal with.
How long did it take you to realize that this hypomanic state that you'd been, that was, seductive and it made you feel good, but it was also destroying your life as time went on? How long did it take you to put that together, that maybe the medication was playing a part in this? Was it the amitriptyline and mirtazapine, right?
It was mirtazapine,
yeah,
and lithium. So 2010 was when I was diagnosed.
Yeah.
And then 2016, everything came to a head. I was going through mixed episodes for that period.
Yeah.
And so then I was seen by a psychiatrist and told I had antidepressant-induced bipolar disorder.
Okay.
And was put on lithium.
Okay.
And I realized that was a very low point in my life. My daughter was around 14. My relationship had ended, so I moved back home. And that was when I realized something is really gone terribly wrong. And it was a very low, like a rock bottom time. That was when I actually seriously considered suicide at that point.
And is this, so you've moved across the country at this point, your second relationship has ended, you've spent your pension, and I guess, and so you're in this rock bottom moment. Is that what got you to start looking at the medications, just because things were so
terrible? They were
terrible. Okay.
Yeah.
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 Okay.
And at that point, I blamed myself a lot. Like you said, when you go through a situation like that, you feel you're responsible for everything that happened and it's your fault. And so there was a lot of guilt. There was a lot of blame. And some of it is, yes, you can attribute it to the medication. But the other piece is you still feel you're a responsible person for everything that happens in your life.
Mm-hmm.
Right? So, and I felt losing that relationship was really tough. And I knew it was devastating for my daughter. And it had an impact in her life as well, a huge impact in her life. And I also felt like I wasn't present for her during that time. And so that was when I realized, I was just like, I don't think I can do this. This is so overwhelming. And I feel terrible about everything. I've lost everything that meant to me.
And how did you, because I think a lot of people on these medications, when their life starts to fall apart, they blame themselves and they stay there. But for you, you started looking at medications, I know eventually diet. What made you look outside of yourself and not simply just say, this is a deficit in me? Is there something else that's contributing? How did that realization come about?
I think in 2017, around that time, I was hired to work in children's emergency.
Okay.
And so I was watching these kids coming in with suicidal ideation, their parents coming in. And I realized I was kind of in the same boat, that I was struggling, but I also had a daughter who still needed me. Mm-hmm. And I wanted to figure out, like, how do I find a solution for this? Like, I still felt like I had a purpose to be here. My work has always been meaningful to me in terms of wanting to help people. Mm-hmm. But I also became really disillusioned in my career at that point. Because I'm like, well, I've seen people, clients in and out of hospitals. They experience the same things that I am: the weight gain, the brain fog, the energy depletion, all of those things. And I wanted to find, I don't think I had wanted anything more than wanting to feel better and move forward. It's just like, there's a saying that a person who's healthy has 1,000 dreams, and a person who's not healthy only has one: to feel better.
Okay.
And so that was kind of where I was. I was like, if I could just find a way to figure out for me to feel better so I could be the mother that I want to be the clinician that I want to be, and just feel better, like feel good in my own body. I don't think like that became an obsession.
And it sounds like what made you question the medications was in part seeing this revolving door situation in the emergency room where people weren't getting better. Is that what made you look at your own medications and start saying, well, maybe this isn't the answer?
Oh, for sure. I mean, I saw kids on the same cocktail, like adults, that, I had kids coming in an emergency overdose on their prescribed drugs. Some of them have attempted suicide or committed suicide in the privacy of their own home. It was, and then you see the parents are completely distraught, like our youth and their parents are in absolute peril. And so it was just everything. And then prior to that, for the 10 years, I was in the adult system. So it's the same thing. People languish through the system. They're on these drugs for years. They're being trialed on litany of drugs. Well, this doesn't work. Let's up the dose. Let's add this little something else. And it's a complete disaster.
The thing is, and I saw that in my training as well. But whenever I asked questions about it, people would say, oh, it's the underlying mental illness. This is the reason these people aren't getting better is because they're severely mentally ill. They've got untreated bipolar. They're not compliant with their medications. And I believed that for a long time.
Yeah.
But it sounds like eventually something switched for you and you were just like, it's time to come off.
Oh, yeah. I came across some information around antidepressant mood switching. I started researching. And then I also started, at the time, I had been on birth control pills for 10 years. And I started researching that as well. And I realized birth control pills make women more at risk for depression, anxiety, suicidal ideation. The antidepressants can induce bipolar type illness. And all of these things, when I started looking at it, and I thought, okay, I need to figure this out, sort through this. So
I imagine that must have been conflicting in many ways for you, because on the one hand, you're taking these medications, but you're also handing them out on a daily basis to people. I mean, what's that like when you're kind of tumbling down this rabbit hole of drug-induced, psychiatric illness and all of that while working there and seeing that every day?
It was awful. You talk about having, I'm sure you may have experienced similar things like confusion, ethical, immoral dilemma, disillusionment, because you're like, is what I'm doing actually helping people or is this harming them? And I am still struggling, just the same as my patients. There's no difference between us. We're both human beings. They're suffering and I'm suffering. Like, how am I making a difference in their lives when all we're doing is pushing drugs all the time? That's the answer to everything. So there was such a huge sort of dissonance, on multiple levels.
Wow.
Right? And so it was not only really hard on a personal level, but professionally, it was this thing, questioning every step of the way. But I did that from day one in psychiatry. I had no frame of reference prior to coming to psychiatry. I didn't even know what psych nurses did. I've never met a psychiatrist in my life before. It was just right out of high school, going into nursing and then doing psych nursing. So it wasn't I believed psychiatrists were bad or medications were good. I really didn't have any that prior experience coming from where I came from.
Yeah.
Either way, it was a neutral thing. So I was kind of innocently stepping into this professional, which I thought was the state of the art treatment, mental health treatment.
Yeah.
So as a patient or clinician, I really didn't have any attachments or judgments either way. So the experience going through it, though, like I said, acute care being the first place that I worked at for 4 years, it was jarring. It's shocking. And there was, those questionable practices you look at and you're just and then the medication being the answer to everything, even though people will say, oh yeah, you should eat right or you should do this. But most of the time you go in to see a psychiatrist, you're going to come out with a diagnosis and a prescription.
Yeah.
And then you're just kind of in that hamster wheel of keeping going. You're just a member of the community once you're in there.
Well, I felt the same way. I mean, when I went out into psychiatry, you just absorb it because that's what everyone does around you. And you say, and I had questions and intuitively things felt wrong. But for many years, I just went along with it because that's what the more senior people were doing. And I think when you're new to something, you just say, well, they must know something that I don't know. This is why they're not talking about they mustn't be talking about diet because diet doesn't really help, or all these other interventions. They must be using the medications because these are mostly biological problems. Because otherwise this wouldn't make sense. And so, I mean, I felt just like that for the first 3 to 4 years when I was doing it, and like you, I started doing my own research. But let's segue now, because I want to ask you, what was your journey off psychiatric medication like? Like, how did you do it? How did you figure it out? Tell me that story.
Okay. So when I look back now again in the past, like since 2016, when I really started my journey of like recovery.
Yeah.
What I understand now is I have implemented what's called metabolic therapies in the ketogenic diet.
Okay.
And that was kind of like a 7-year period from 2016 to in the last year and a half or so.
Yeah.
The first thing I did was I got rid of birth control and I got an IUD, non-hormonal. So that was a huge step in the right direction. The next thing that I did was I gave up shift work, which I was working like 2 12-hour shifts and then 2 day shifts and then 2 12-hour night shifts and then 5 days off. That's the typical schedule for nurses. In general, like 90% of nursing, that's what you get is shift work. And they say that, I think it was a Journal of Medicine, said that shift work takes about 10 years off of someone's life.
Wow.
Yeah. So I gave that up. And so my circadian rhythm was reset. Then the next thing I did was I actually got rid of my car and I was walking 5 to 10K a day, which would get me partly in ketosis, right? And I also did intermittent fasting, like 16, 18, 20 hours a day. So I was primed, like in terms of being in ketosis pretty much every day for about a year. So the next thing I did was I did the elimination diet, carnivore.
Okay.
So for about 3 months, it was salt, beef, and water. And I came across that information from watching Jordan Peterson and Michaela Peterson.
Sure. Yep.
Where they talk about their own recovery from multiple health complications. And coming off of, I think Michaela came off of 10 or 13 different drugs, including antidepressants. The same with Jordan Peterson. So I thought, let me try that diet. I think the carnivore diet is fantastic in that it allowed me to see what I was sensitive to. Like I had serious sensitivities to dairy. I'm sensitive to gluten, not celiac, but like I would get bloated, I would get tired, exhausted. So the carnivore diet allowed me to kind of really see what does my body react to in terms of food.
Okay.
So then, but what I found when I was doing carnivore was that I kept having reactive hypoglycemia, which is like really low blood sugar, to a point where one time I lost consciousness and I had to go to hospital.
Wow.
Pretty scary.
Yeah.
But I think this is one thing that I would say to people is that you really have to approach this diet change very methodically and with caution because everybody is different. So there's really no one-size-fit-all approach when it comes to this. And then you would want to have sort of medical supervision. Like I was monitoring my blood sugar, blood pressure, heart rate, weight, ketone levels. I got some blood work done. So it was supervised by my physician at the time. So it's really important to look at everything. So what I realized is that I need a little bit more carb. Like I can't just do with the carnivore diet, you're looking at just really mostly protein and fat. That's it. Like there's nothing else. So that's when I started researching the keto diet. So I came across communities like the Metabolic Mind, Dr. Chris Palmer's work, like about metabolism. Dr. Georgia Eats information. Like there's a huge community there. And I realized adding just a little bit of carbohydrates from my diet, that stabilized my blood sugar. Like I have not had even like an incident of low blood sugar since that time.
Yep.
So I felt, even though I loved carnivore, and I would say the majority of my diet even now is carnivore, I do like having a little bit of carbs. Like you can have 20 gram to like 50 grams of carbs on a keto.
And when you started doing these diets, what did you learn about your health? Because I imagine you only sort of stuck with it because you noticed benefits.
Yeah.
So how was your previous diet, the standard Canadian diet, how had that been affecting your health? You know, looking back in hindsight, you know, once you got rid of all of those things, what did you notice?
So something I noticed when I was doing especially carnivore initially, I really kind of suspected there's like a connection between diet and mental health or just overall health.
Yeah.
I knew that. And I wouldn't say that my diet was like terrible. It was, I still tried to eat healthy.
Yeah.
But what I found was when I was doing carnivore, I would have really serious cravings. Like I would be just daydreaming about fresh bread with butter, pasta, ice cream, like all of these things. And I would have once in a while, every few weeks or so, I would indulge in it. And I would feel awful. I mean, like within about half an hour to an hour, I would want to just lay down and go to sleep. And I'd pass out for like 2 or 3 hours, like after having gluten or dairy. So that was like sort of an aversion therapy, but also that's another thing that people are going to experience. When you start to clean up your diet, you're going to have intense cravings. That's when you realize like we are really food addicts.
Yes.
Like we use food for pleasure, for distraction, for emotional eating, like all of that. And I think that was when I realized how that connection between how much food impacted me was when my diet is clean for like 2 or 3 weeks, and then I would indulge on something that I used to eat, which I thought was like fine, grains or dairy or sugar or whatever. And my energy would just tank, and I would have like, my mood would be off. It was almost like I don't drink alcohol. Like I had never been a drinker. I might have like a glass of wine or like one drink once a year.
Okay.
And when I do, I feel it for anywhere from 3 to 7 days, like in a bad way.
Okay.
So I had sensitivities to begin with as well, just to substances, alcohol, like for anything. So it was interesting to see how food was kind of in a similar way. And what I noticed initially was right away my energy improved. So I wasn't sleeping 12, 13 hours. I had like mental clarity. I had abundant energy to a point, by the way, with keto. Sometimes people think they're going through a hypomanic state. Initially, especially when you go through the keto adaptation phase, where your body's been used to, burning glucose, and now it's switching to fat burning mode. I noticed that I just felt like good in my body, and I lost weight, I went into my ideal weight, which is between 110, 115 for my height and for like my body frame. So that was because of intermittent fasting, the walking that I was doing, and then the diet. So you stack up those 3 things. If you're someone who's like wants to lose weight, that's what you're looking at. You want to kind of like stack up these things that will affect the change. So yeah, what I found is that there was like incremental improvements and changes in major areas like sleep, like weight, metabolism, the blood sugar normalizing, energy, increased energy, mental clarity. And the other piece I noticed, a huge thing I noticed, was when I was on psychiatric drugs like lithium and mirtazapine together, I was kind of numb to my emotions. It felt like I couldn't access all of my emotions, or at least the range of emotions that I had. And so it felt like I was just in this even keel. Some people describe it as being in a straight jacket. And when I started to implement all these things over time, I felt like I could really be in touch with more of my emotions, including like accessing grief and traumas and even the journey that I went through in the past 13 years where I experienced all the things. So that kind of started to really to come up, like kind of waves of grief. So those were lots of changes, most in a very positive way. And I also felt like I could connect with people a little bit more so than usual.
So you're starting to feel a lot better in multiple ways. Mm-hmm. Was your plan always to come off the medication, or was it just something that you had gained the courage to do once your health and your mental health and your physical health had improved?
I had always wanted to come off of the medications because I've always known there was a huge connection between psych drugs, adverse effects, and long-term use and adverse effects. But what happened was, as you know, there's no tapering guidelines. People are told to come off within 2 to 4 weeks it doesn't matter how long they've been on the drug. And the multiple times I had tried to come off, I ended up going into severe insomnia and not being able to come off of the drugs. And of course, the message is always, this is the worsening of your condition. You have to be on these medications for life and you can't come off of them. So I knew there was something, that connection between medications and adverse effects. And what happened was with the tapering, once I implemented all of these things, like I said, the metabolic therapies and finally the carnivore and ketogenic diet, I felt so much better. And the other thing is I did CBTI. I studied a bit about CBTI. So I felt more confident that, and also learned a bit more about proper tapering. That's how I came across your information and Mark Horowitz's information and the tapering community, the support that's online. And I realized, I hadn't actually done tapering properly. And now I have all of these tools and all of the things that I have implemented. Maybe this time around, it's going to be a different experience to actually go through that process. And so I actually ended up partnering with a pharmacist who was very supportive, and my physician was quite supportive as well. And she'd been through the whole gamut with me throughout my journey. And so I started tapering slowly, and I also did, like I said, work with a compound pharmacy when I came off of mirtazapine specifically to get 1 milligram at a time at the last, from 7.5 to the bottom, to the end. I was able to taper at a higher dose from 30 milligram to 7.5, but then I had to use a compound pharmacy for that.
Like a liquid compound?
No, wasn't not a liquid compound, but on the tablets, they were able to put much, much smaller doses. And I was tapering from 14 to 28 days. So, yeah.
And so, how long ago did you step off your last medication?
So that was the whole process. I was on a very low dose of lithium, by the way, was 600. And it was subtherapeutic, at 0.4 in terms of the blood level. But it was still working okay for me at the time, as in when I was on it for the time I was on it. I would say it was about a 9 months period. And the last mirtazapine tablet I took was last year in December, the end of December. So it will be a year this December.
Wow. Okay. Well, congratulations.
Yeah. It's just one cycle, one season, fall and technically about a year and a half where I was tapering for the 6 months, 6 to 9 months, and then almost a year of no medications. Yeah.
So let's talk about that. What has the last nearly a year been like for you since stepping off the mirtazapine and the lithium?
It's been really interesting in many ways, and it's been a ton of change because everything kind of came to a head when I realized this is what happened. And I kind of connected all the dots in terms of my career, psychiatry as an industry, being able to implement metabolic therapies and the keto diet, and all of it. And then I looked at it and I thought, this whole thing the suffering could have been prevented in simplest of ways, as in that time when I was 30, when I was diagnosed, the conversation about burnout never came up. The conversation about a significant childhood trauma never came up. Diet, ketogenic or carnivore, never came up. The whole time, the 13 years I was going through, like swinging back and forth and having to live with all of these adverse reactions and my life being like a complete disaster in many respects, it was like, this could have been prevented. And what about all the people that I saw and all the patients who were also in this kind of hamster wheel? How come the only thing that is always offered is just drugs? And so a year ago, in November, I actually left my job. I felt I was working in a kid system, and it was like the last straw that broke the camel back was just like seeing kids who were on benzos, in protracted withdrawal, in acute withdrawal, being just discharged. They're, being told they're medication seeking. The protracted withdrawal is not recognized. The acute withdrawal is treated very briefly with diazepam, like to prevent seizure. But they don't have the lay of the land in what these people are actually really going through. And I recognize that even more, like working with you in the past few months was just like, oh my goodness, the traditional system, the conventional system has no clue what these people go through.
Have you ever watched the Matrix movie? It's kind of like a feeling, like I felt like that. I imagine you probably maybe relate to it more, because not only is it like, I mean, we both worked in that system for a long time and treated people in ways that weren't helpful. And so, but I know for you, I mean, you personally, it wreaked havoc on your life. But there's the scene when he, I guess it's like the red pill, blue pill. I can't remember which one he takes, but he takes one, and, the kind of this metal just sort of kind of engulfs him. And then he wakes up in this pod, and for the first time he realizes, that he's been living in a fantasy. He's been living in a simulation. And in a big way, that's what you have been going through in this last year, where you come as an immigrant from Ethiopia, you're in Canada, what I imagine seems like a very developed and professional country. There's no reason to doubt what's going on. You get sucked into the system, you trust it, you work it. I mean, gosh, you're even a patient in it, only to realize that for the last 20 years or so that you may have been inadvertently harming people, and that it had also harmed you as well. And it's crazy. It's a crazy thing to wake up to. It's almost unbelievable to see this level of harm,
deep suffering.
Yeah.
And needless suffering that could have been, there's suffering in life. Like we all get a share of our suffering in life in many different ways, whether it's a health challenge or somebody passes away or something happened to our kids or whatever it is. But what we're talking about here is harm that could have been prevented. And the first kind of rule of medicine, as they say, is do no harm. And this does a tremendous harm. So it was disillusioning on a personal level, on a professional level, and hard to really just fathom and just kind of like come to terms with. So when I talk about grief, it's not just the personal loss and things that have happened in my life, but also, yeah, you're right. Like I have built my life around this career that I thought was meaningful and helpful and honorable. And then to realize like I'm part of an industry that really harms people. And I was a part of that. I was the eyes and ears of psychiatrists. I handed out the cocktails of the medications. I wrote the orders. Yeah. I told the patients that they have a chemical imbalance in their brain. Yeah. It's awful. It's an awful...
All those things as well. Yeah, it's it. I had Mark Horowitz on here, and he talks about being haunted by experiences where they used to go to, because I think he was on an assertive community outreach team, where some people, they'll, because they have bad psychosis and they don't take their medications, you actually go to their homes and try and check on them. Well, of course, you encourage them to take medications.
Yeah.
And he remembers being on a team with, I guess, a senior doctor, and there was someone pacing around the place in akathisia, and the doctor saying, oh, his psychosis must be really bad. He's not taking his medications. And then they injected him with additional antipsychotic when he had akathisia, which typically will make it worse.
Yeah.
He says he feels haunted at night just imagining, because he doesn't know what happened to that guy afterwards. But there's so many of these terrible things that we've been a part of. And so I'm right there with you. I do want to segue though, because I want to ask about your health and your mental well-being off this, because some people, when they come off the medications, they worry, I'm just going to collapse. Like they second guess, it's going to come back. There's a problem with me. But how do you feel, like physically, mentally, emotionally, off the meds?
It's been, like I said, an incredible journey of feeling more and more of myself. But there is definitely fear initially, like I said, when I was going through the keto adaptation phase and the changes that I was going into hypomania. And then the fall and winter, when they come, your energy shifts a little bit and you think, oh my God, am I going into depression? Like that fear that you've been told you have a chemical imbalance in your brain and this is for life and you need the medications. And if you don't take the medications, you're going to get sick. That's a type of trauma that happens and you don't get over that right away. So I would say the past year, and it's also been terrifying to make all these changes, as in like to leave a very secure nursing job. Like I could go anywhere in the world, anywhere throughout Canada, have a job, have security. So I decided to explore entrepreneurship. So the past year, that's what I've been doing. And that's a terrifying journey on its own. And in terms of the illness coming back, fear, absolutely, it's there. Yeah. It's like palpable because you're just like, essentially, I think the worst thing that happens in psychiatry is people are taught not to trust their intuition, not to trust their body's feedback, not to trust what they're thinking and what they're feeling. Because you have a diagnosis, those things become irrelevant. Your judgment is off, and so you can't be trusted. You can't trust yourself. And so to go through that process, the past year of saying, I'm going to pay attention to my body's feedback. What is this telling me? And are there ways for me to cope with whatever symptoms arise, especially when I have like really intense emotions of grief coming up about the past, about what happened to, in my life with my daughter, what happened to my relationships, what happened to my career. Like, so when that stuff comes up and the season changes come up, like spring and summer, fall and winter, I have associations with those. Even in the past few months, I've struggled with that because I'm a person who grew up close to the equator. Like the Canadian weather, like being here has never come like naturally to me. So my energy kind of shifts a little bit. Like I sleep a little bit more in the winter time. My energy feels a little bit lower in the winter time, but not to confuse that with like, I am completely depressed. That's not what's happening. The same within the summertime, spring and summer, I feel like I have a little bit more energy, more so than in the winter time. That's the thing that psychiatry really blurs for people is what's normal and what is illness and disease.
And some time to relearn that, right? Because if you're on meds for a decade, or Trudy, who was on them for over 20 years, it's like, do you even remember what normal emotions are for you after that period of time?
I have chunks of times that I have no memory of, as in like my daughter and I would be hanging out the same places that we have, and she would say, do you remember this? And she recently came to visit me, and we were hanging out where times when she was little, places that we went to, I could not recall them. Like I have chunks of memory that are just gone, right? And as far as the whole process of recovery, it takes time, not just physically. Like, I think the physical aspect is probably the easiest one to recover from, to lose the weight, to gain your energy, to have your mental clarity back. But the emotional and sort of like the traumatic experience of going through that type of journey that makes you question your own sanity, your own feelings, your own intuition is like, that's hard to overcome. And I think that takes more time and processing to really be in tune and in sync and like grounded in your own reality. And I did not know what my normal was. I would say that's another thing that I was able to establish the past year is like to say, what's normal for me? Like what foods are fitting from my body? Like what makes me feel better when I eat this, or what activities, or, mindfulness, or walking in nature, or connecting with people, or doing work that's actually more meaningful to me, even though it feels terrifying at times to be an entrepreneur and to be doing my own thing. And so it's a real journey to recover from all of it, and then to kind of like go in a different direction as well.
And I mean, so what I'm reading into that as well, and this was just a little detail which I think is important. It does sound like you experience greater mental clarity and energy off the medications as well.
Yeah.
But like you said, it's almost that psychological toll of being told for 10 years that you're mentally ill and not knowing your emotions. Wow.
Yeah. The message of like, you are sick for life, you have an incurable illness, that is devastating. And most people get that when they're 17, 18, 19, 20.
Yeah.
From a specialist, a psychiatrist who's gone to school for 13 years, to say, you are sick. There's something wrong with your brain that cannot be fixed.
Wow. Yeah.
It's powerful. And to overcome that to a place of, I am healthy, I'm whole. Yes, I have sometimes emotions that are, challenging and can be, I experience drastic states of consciousness, let's say. But that doesn't mean there's something wrong with me or that I am sick. It's just that this is the human experience, and nobody has sort of like the corner of like what is really normal, if you're the level of your functioning and the quality of your life at the end of the day.
I mean, I feel like that sort of that indoctrination into you are sick, you have a brain disease, is what made it so hard for me to practice in the conventional psychiatric setting, and why I also needed to go and do my own thing, because I would see people who were really harmed by the medications, and I would bring it up with them. And at this point, they're already on the drugs for like 10, 20 years. They've almost grieved the whole thing. They've grieved and accepted that they're mentally ill for life. And you bring up, maybe we should go lower on the meds, maybe we should try a diet, and they're not ready for it. They're stuck there, and that was painful. That was painful for me to do, and so now, obviously we do this, and we're just working with very committed people who want to come off their meds. But I think people need to arrive there on their own to have that door open where they're just like, hey, maybe there's another way.
Yeah, well, and the other piece is Dr. Georgia Ede and Palmer talk about how this is a metabolic disorder. Like they're basically making the connection between metabolism and the mitochondria being affected, and food, which is the precursor of like all our bodily chemicals and hormones, making that connection. Also, the people that have really a lot of psychiatric issues are also the people who are struggling. Chris Palmer talks about the ones that have obesity, diabetes, metabolic syndrome, and then the psychiatric issue. There's a huge correlation there. So, and this is something that's non-invasive that anybody can implement. But yeah, you have to come to that desperate place of just like, oh my God, I cannot keep living this way. There's got to be a better way to make this work.
And for everyone, it's like a different rock bottom. I know for you, it was, the relationship ending, things with your daughter not going well, moving back across the country for Trudy. for Trudy, it was when she developed protracted withdrawal. And that is, for a lot of people that we help, they develop a severe injury from a medication, and then it just blows the doors open and they start looking.
Yeah.
Yeah. But Neseret, I will say, I think now is a good time to wrap, because we're going to get you a massage while you're here visiting us. And we don't want to be late for that. So
yeah, this was a great conversation. Thank you.
Thank you for coming here,
Yeah.
sharing your story.
Yeah.
Yeah.
Yeah, I appreciate it.
If you're interested in more videos about people dramatically recovering from serious mental health problems using dietary interventions, you are not going to want to miss this next video here.